So my name is Jackie Demirovska. I'm from the Cornerstone Community Church team, working together with James Henderson and his team from Transforming Communities Together, and Anne Horder and the team from Dudley Council, including public health, communications and community development. And as we've said, we really want to thank you for joining us this evening on the final week. We welcome you if you're new to the sessions, and we welcome and thank you again if you're joining us from previous sessions. Just as a reminder, this is a community engagement event. It is so important to listen, to hear what the needs are of each local community. And throughout the weeks we've been on a journey. We've been talking through public health key messages. We've been looking at diabetes, obesity, and having a healthier lifestyle. We've been looking at respiratory and other chronic health conditions, including chronic heart disease, chronic kidney disease, and keeping fit. We also looked at mental health last week, which also included domestic violence, suicide prevention, and working with young people. And we really appreciate your time, and we're really hoping that people are able to follow up on some of the helplines and advice that was given. So this week, week 5, is a focus on the community engagement and involvement and life in the new normal. So we want to just think about how do we move on, how we're moving on in the community. Just got a quote here that says, there is no power for change greater than a community discovering what it needs and what it cares about. So we can't emphasize this enough. And also, there's an African proverb that says, if you want to go quick, go alone. But if you want to go further, go together. So we want to continue in this together, and other members of the team will talk about what will be happening post these events. But it's really important tonight to also let you know that we will be having a snap kind of survey. So it's a quick survey via Zoom. So it could be a Zoom poll, and we'll do that as part of the meet and greet. But also to let you know that Dudley Council, as part of the working group, will be completing an evaluation, a wider evaluation via SurveyMonkey, and one of our colleagues will talk about that later on. So we want to thank you again, and of course we want to thank our speakers. We talk about the model of engagement, being about mobilisation, working with experts on the front line from a medical, clinical and care and public sector background and community background. So our speakers tonight are Dr. Lola Abadou, Julie Black and Dolores Nelany, Sharon Tilt. We've got Cassius Francis from TCT via video, but his colleague James Henderson will introduce his session. So without further ado, I'm going to hand over now to Dr. Lola Abadou. Thank you.
Good evening, everyone. My name is Lola Abadou, and I'm Deputy Director for Health and Wellbeing for PHE in the Midlands. And I'm really delighted to be with you this evening. COVID-19 has been a devastating experience to many Black, Asian, and minority ethnic communities. And I want to acknowledge the pain and trauma that some of you on this call may have experienced personally or in your wider community. But I hope through our conversation together, we can consider how we can move forward. Over the next 20 minutes or so, I'd like to give you an overview of the evidence of how COVID-19 has impacted on BAME communities, focusing on the findings of the PHE Disparities report. I want to include a little bit of insight on COVID-19 and pregnancy. We'll look at some of the key findings of the PHE stakeholder report and reflect on the local insights that we have through the combined authority roundtable event, and then think then about how we move forward from here together. Next slide, please. PHE's report on the disparities and the risk and outcome of COVID infection was published in May 2020, and PHE was tasked with undertaking a data review, and this table summarizes the range of data reviewed for that report. The report confirmed the findings from anecdotal reports and earlier descriptive studies that there were indeed disparities in risk and outcome of COVID infections. The range of data looked at for the report were confirmed cases of COVID-19, hospital admission data, death registration data, and we also looked at a variety of things such as age and sex, geography, ethnicity, occupation in the context of this report. Next slide, please. So in terms of the key headlines, there were clear inequalities in mortality rate from COVID-19. And in particular, those in more deprived areas had twice the mortality rate of those living in the least deprived areas. And there was also a gender disparity, with males having a much greater mortality. Next slide, please. There was also significant differences in mortality rate by ethnicity, with those particularly from a Bangladeshi background having twice the mortality rate, the risk of death, than those from a white British ethnicity. And there were also differences between a 10 to 50% higher risk of death from, for people of other ethnicities. Next slide, please. So in terms of the summary, there is a significant inequality by age group, with older people much higher risk of death than younger people. A difference between those who are in more deprived and less deprived areas, and particularly in relation to ethnicity, those from Black and Asian minority ethnic groups compared to white British. And these figures were adjusted for age, sex, deprivation, region, and ethnicity, but not for the existence of comorbidities. But we have found in subsequent evidence that once we include comorbidities, the difference in the risk of death in hospitalized patients is greatly reduced. Next slide, please. In terms of death certification, those conditions that are more likely to be on death certificates were diabetes and hypertensive disease. And this slide shows the differences in that. Particularly, diabetes was more likely to be mentioned in death certificates in more deprived areas. So 26% of deaths mentioned diabetes compared with 16% in the least deprived areas. And looking at ethnic groups, it was about 18% in the white ethnic group compared to 43% in the Asian ethnic group and 45% in the Black group. We know that particular ethnic groups have higher rates of long-term conditions associated with COVID fatalities. So Afro-Caribbean people have a higher prevalence of high blood pressure. South Asian people, particularly first generation, have a higher prevalence of coronary heart disease. South Asian people also have a 6-time higher, more likelihood to have type 2 diabetes. African Caribbean, South Asian and people of Mediterranean origin are more likely to have sickle cell disease, which is also one of the conditions identified by the NHS as having a higher risk of mortality. Next slide, please. So what about COVID and pregnancy? I think it's important to recognize that there are the context of maternity, maternal health and pregnancy outcomes for BAME women. The Embrace UK report published in 2019 highlighted major inequalities in perinatal outcomes associated with ethnicity, with Black women being 5 times at higher risk of dying in pregnancy than white women. Overall, we know about 23% of women who died between 2015 to 2017 were born outside the UK. A number of factors contribute to this. Some are individual biological and behavioral factors. There are wider determinants that influence this, such as ethnicity. And then there are also factors related to the utilization of healthcare services. And we know that there are issues around accessing care, and women from BAME communities have a range of experiences of services. Sometimes there are reports that services are not as sensitive as women would like to their needs. Next slide, please. The UK obstetric surveillance studies, the largest study that's looked at risk factors for hospital admission with COVID, and in this, Black and Asian and minority ethnic mothers are at higher risk, and overweight and obesity is also an important risk factor. And we know that this is much more common in people from BAME backgrounds. Next slide, please. Just on the point of pregnancy and maternity, I think it's just important to also mention that there isn't any data at the moment which suggests there's an increased risk of miscarriage, early miscarriage, or pregnancy loss in the second trimester associated with COVID. So the next report that PHE produced was looking beyond the data, and this was really about gathering the views and understanding of a wide range of stakeholders about the impact of COVID on BAME communities. We engaged with over 4,000 stakeholders across the country and the devolved nations, from faith groups, academics, local government. And the key objectives really of this exercise was to clarify PHE's research review terms of reference, so folk have a clear understanding of that, to try and engage with these stakeholders to understand their views in terms of current concerns, activities and priorities for work. But it was also an opportunity to identify opportunities for individual and collective action. A rapid literature review was undertaken in collaboration with NIHR. Next slide, please. So what did we find? Some of the key findings were around BAME groups being more likely to be tested and to test positive for COVID. We've talked about the increased risk of death associated with COVID. But one of the things that they found was that ethnicity and income inequality were independently associated with COVID mortality, and both of these income inequalities particularly affect BAME groups. There were other wider factors, such as increased likelihood of living in an overcrowded accommodation. BAME groups were overrepresented in occupations that placed them at increased risk of being exposed to COVID, such as in health and social care occupations, working in public transport, security. And then there were other factors such as concerns about BAME groups being less likely to seek care at an early stage when this is needed, or to speak up when they had concerns about access to personal protective equipment or testing. Next slide, please. So what were the key themes and sub-themes which emerged from the stakeholder engagement sessions? One, stakeholders were clear that this isn't something new. Really what COVID has done is to really display the impact of long-standing social and economic inequalities, and stakeholders really clear that we needed to tackle this systematically and involve a wide range of groups, including the voluntary and community sector, the community themselves, vulnerable groups, and the faith community in discussions about how we tackle this. The discussions highlighted the increased risk of exposure to COVID-19. There were concerns about the increased risks of complication which related to access to services, mental health issues, how we deal with long-term conditions, the need to get the widest parts of the community engaged in the conversation and mobilized to address health conditions. But racism, discrimination, stigma, and fear were real issues, and you know, people really talked about the lack of trust that there may be in service providers, and a number of different views was put forward about how we could move forward together, and you know, really harnessing passion and commitment for change, making sure that we use our community assets and you know, engage with culture and faith in those conversations. Next slide, please. These concerns resonated with local voices and the messages which came out through the roundtable, which was hosted by the West Midlands Combined Authority. And that group of stakeholders highlighted the central importance of faith and community organisations in engaging more widely, and these groups being seen as trusted spokespersons within the community, you know, with credibility to take out key messages. They talked about the need to rebuild trust and reduce fear in the communities regarding the NHS. They highlighted the need to tackle structural determinants, but there were also important concerns that they raised about making sure we don't use, that this isn't an opportunity to blame communities. And then they also highlighted some of the risks around digitalization of services, and really trying to make sure that the push for digitalization didn't exacerbate inequalities. So let's move on to the next slide. So there are 7 key recommendations. One about more comprehensive data collection, including ethnicity data, the need for participatory research so we can engage with communities, the importance of improving access and experience of care across NHS, local government, and the importance of making sure all types of workplaces provide appropriate occupational risk assessment tools. Next slide, please. The recommendations really pick up on the need for cultural competence, whether this is in our education and prevention campaigns or in terms of health promotion and disease prevention programs. And then also taking this opportunity as we think about recovery strategies of building in proactive processes to tackle and reduce health inequalities, focusing on the wider determinants of health. Next slide, please. So what's happening in terms of responding to the recommendations? PHE's looking at its own work in terms of taking forward the recommendations, making sure through the test and trace program that we are recording ethnicity. We're proactively trying to ensure that our data sets pick up ethnicity, working more widely with our system partners. There's ongoing liaison with the government and support with other government departments. And within our local places, we're working with the rest of the local system to take forward things like ensuring that our recovery plans build in health inequalities, recognize the need for our BAME communities and those with other protected characteristics, and really look at some of the wider determinants. Next slide, please. So how do we move forward together? What does it mean for us? Next slide, please. Clearly, there are a range of responses and interventions that are needed to make a difference, and these things need to happen across the life course. So, for example, improving access to services. This slide focuses on how we might improve maternity outcomes. It's about understanding the needs of our local population, making sure we have appropriate universal and specialist services. We need to implement evidence that is out there. We know that continuity of care makes a difference in improving pregnancy and maternity outcomes, and we need to make sure that we can implement this for BAME women. Within our services, we need to be actively addressing issues of racism and discrimination, making sure our BAME workers have appropriate occupational risk assessment and support, and that needs to be built into our staff health and wellbeing approaches. Next slide, please. We need to go further back, upstream. We know that there are inequalities in relation to things like school readiness, which will influence, our young people's ability to engage at school and in terms of their opportunities to be economically active. Next slide, please. And so it's important that we tackle these issues to make sure that our children and young people are ready and they can take advantage, economically. Next slide, please. The other issues that we need to pick up are around addressing individual lifestyle risk factors and behaviors. Smoking, overweight are important drivers of poor health. This particular slide looks at some of the variation in smoking experience across ethnic groups and in relation to deprivation. So smoking prevalence is much higher in our more deprived communities. So those things are important to address. Mental health we've already talked about, and I know there's been a focus in previous seminars. Next slide, please. But one of the most powerful things that we need to do is taking community-centered approaches to health and well-being. We need to engage and mobilize our BAME communities to take action. We know that placing communities at the heart of public health can help us in reducing health inequalities, engage those most at risk of poor health, so we can share knowledge, particularly about COVID, for example, with our community members, help to tackle myths and misunderstandings, help our community members to access services, so test and trace, for example, dispelling myths about the way in which that might work. And also, I think it's about the opportunities we have to encourage culturally appropriate lifestyle, healthy lifestyle choices. So we need to make use of all of our community resources. So next slide, please. So thinking about the wide range of community assets. We've talked already about the overrepresentation of Black and minority ethnic groups working in the health and care sector. How do we use that expertise more widely? They're the resources within our voluntary and community sector and faith organizations, you know, our friends and neighbors, those that we connect with. Each of us has an important part to play in this. We can all be part of the solution. Next slide, please. I think it's really great to see the commitment from Dudley Health and Wellbeing Board to engage the community in its endeavour. And I think it's only with that partnership with our local communities that we can really make a difference and together deal with the wider determinants that are placing our communities at greater risk, and in terms of making sure that our communities can benefit from the range of services and interventions that are on offer. Next slide, please. So all of these things together, the civic level interventions, the service-based interventions, the community-centered interventions are all part of the way in which we can take a place-based approach to health inequalities. And, you know, each of us as individuals play a part in bringing those areas together. We can be the glue to make change happen within our local places. So just to finish off, we've talked about all of these interventions more on an organizational level, but I think that each of us as individuals also has an important role to play. And I think that brings us on to my final slide. So checklist for a healthy you. I think when we talk about the health of our populations, we also need to start talking about our own health. And I think it's really important for each of us to get those health niggles sorted. You know, if we've got chronic conditions, you know, are we treating those optimally? You know, if you've got diabetes, hypertension, or whatever, I think there's lots of things that we can do to make a difference in terms of healthy eating, keeping active. For me, activity is the magic medicine because it helps with our mental health, helps with our physical health, and makes a difference across the whole of the life course, from children and young people up to the oldest adults. And I think that really brings it to the end for me. There's a lot that we can be doing together. And just to say thank you to those who contributed. There are a number of resources, next slide please, that you can access that will provide you with a bit more information on what you can do. Without further ado, I will hand over to our next speaker.
So Julie, I think you're going to start the next presentation. Thank you. I hadn't got the message that I could unmute, so forgive the delay. My name is Julie Black. I'm Public Health Manager with Dudley Council. And my focus, a part of my role, is really to focus on creating healthier workplaces. And we're going to look tonight briefly on creating healthier workplaces as we return to work for some of us have obviously stayed at work, but in terms of the new normal, as people are referring to it, in terms of coronavirus and what we can do, and I'll just go through some of that, then I'll hand to Dolores shortly. If I can have the next slide, please. So one of the things we have to refer to support people and information is the rules and regulations which are issued by the government. So the key site, if you're not familiar with this, is the government.uk coronavirus site. And I've put a screenshot there of just some of the guidance and regulations that are on that site. It is reasonably easy to navigate, so it is worth looking into. And as you can see just from that small screenshot of the menu, there is information and advice on there about how to work safely and what's required, but also for businesses, if you're an employer, what you will need to do to ensure the safety of your staff. The rules and regulations change frequently. There's been 2 changes this week which we'll touch on. So it is always worth checking them, particularly if you have concerns about the safety of your workplace and want to raise an issue. It's worth checking the current rules and regulations, just in case there's fake news or unclear news, or it's changed. So that's the main site. The other site reference that I've put on there is a Greater Manchester-based voluntary organisation. I found that site had really good layout and easy to navigate, with lots of links to the information from the government site in other languages, and also there's some audio support, and there's links to other agencies as well. So it's a good source of trusted information that you might find easier to use. Next slide, please. Okay, so from Dr. Lola's presentation, which personally found very interesting, we've heard a lot of information about how people in BME communities are affected. And in terms of workplaces, the reports that Dr. Lola touched on talk about the reasons where there's a higher prevalence of COVID is because of the likelihood of BME community people in front-facing jobs. By front-facing, this could be working more closely with the public or more frequently. For example, our care workers, bus drivers, taxi drivers, roles that often cannot be done from home. So it's really important that we do what we can to reduce the virus. And obviously staying home might not be an option. So in having to return to work, we'll come on to some of the risk assessments, but the advice on social distancing still remains. It is 2 meters or 1 meter plus, and the 1 meter plus means if you've got some other protection. So if you can, stay at 2 meters. The hand washing remains a really good way of maintaining hygiene and cleanliness. And the rules on face coverings, as you know, we all need to wear face coverings from this weekend in shops and banks and various places, and that's been announced today that that's going to change and become regulation from next week. So any public indoor space, you'll need to have a face covering. As I put up on the slide, the previous slide, there is government guidance on how to make your workplace COVID secure, and your employers should be making COVID secure. And we'll be talking about risk assessments, and Dolores will cover some of that. And you might see changes in your workplace already about what COVID secure could be. So it might be that you've got screens up, you've gone into shops, there's been screens. It might be you've seen layout changes, one-way systems. It might be that you've had different shift changes to try and perhaps reduce the time or the congestion time on public transport, or you might also have to wear PPE, which you might not have done before. We'll come on to shortly about how you can raise concerns if your employer is not COVID secure, or if you've got concerns that the government is not following advice, and Dolores will cover that in a moment. But if you are worried about it, what you can, particularly if you've been away from work, if you've been furloughed, if you are worried about returning to work, Citizens Advice can help. And I've put the link there as well, which will be available, but you can give them a call and talk them through your issues there. Okay, could I have the next slide, please? So just a reminder about the test and trace. Again, I put the links there so you can see how it works. Now, this is an example of how quick things are changing. So you can see that we've put in the slide, if you have symptoms, self-isolate for 7 days. That was drafted on Tuesday. Yesterday, that's been changed to 10 days. So now if you have symptoms, you do have to self-isolate for 10 days, and you need to order a test. You can do that from the NHS website, or if that's not possible, phone 119 and they'll sort a test out for you. Now, if you have to self-isolate, you might need to be able to work from home. But if you can't work from home, you may be able to claim SSP. But if you're not entitled to SSP, then you might have to take some annual leave. If you haven't got annual leave and you might not have any income, that's where our benefit advisors might be able to help you. And Sharon, who's a later speaker, will cover some of those issues for you. Could I have the next slide, please? Which I'll hand to Dolores to take through what you can do if you've got concerns. Thank you. Dolores.
Thank you, Julie. I'm Dolores Nellany, Head of Environmental Health and Trading Standards at Dudley. My teams work on a daily basis with businesses across the borough, supporting them to provide safe and healthy conditions for their staff and for their customers. And as you can imagine, we've been extremely busy during the pandemic period, assisting businesses, from those that were able to remain trading throughout, such as the takeaways and the factories, and more recently those that have been able to reopen in the more recent easing phases. We've been responding to complaints and inquiries from employers, employees, and occasionally customers as well. So what do you do if your workplace is not COVID secure? Firstly, if you feel comfortable doing this, you could raise it with your manager direct. Ask to see the COVID risk assessment, which every employer should be carrying out. Risk assessments don't have to be in writing unless 5 or more people are employed. So even if they're not written down, they still have to be done, and your employer should be sharing them with you and should be training you in any controls that they've introduced to guard against the risk of COVID infection in the workplace. However, if you don't feel comfortable talking to your employer, you can make an inquiry or a complaint to us here in Environmental Health. The easiest way to do that is phoning Dudley Council Plus. The number is there and it's widely publicised. In reality, some workplaces, such as factories, farms and government offices, come under the Health and Safety Executive for Health and Safety Enforcement and not the local authority. However, we work very closely with HSE, and we do channel the complaints that are on HSE enforced premises to HSE, and we'll always advise you of this if you make a complaint to us and it's premises enforced by HSE. Your contact with the council or with HSE is completely confidential. Your name will not be given to your employer. We do ask for your name and contact details so that we can contact you to feedback to you on your report. You don't have to give them. You can make an anonymous complaint. Sometimes it may be possible for an employer to guess who's notified us. For example, you may have raised the issue directly directly with them already. However, we never reveal the source, even when presented with the challenging question, was it so and so who complained? We never reveal the source. If we feel before we contact a workplace that you could be identified, we would discuss this with you, and we would consider all options for going into the workplace without even saying there's been a complaint. So do be assured that your details are kept confidential. You also, if you make a complaint about health and safety to us, you are given protection in employment law under the whistleblowing processes. So to whistleblow, it has to be in the public interest, but clearly reporting a danger to someone's health and safety is always going to be in the public interest. So anyone making a health and safety complaint is protected in law, in employment law, from unfair treatment, dismissal, and so on. Next slide, please. So if there was an outbreak in your workplace, what would happen? Firstly, we encourage employers to tell us about cases as early as they suspect there's a problem. So even before that first positive case, there might be suspect cases in the workplace with symptoms. This enables us to provide all the help and advice we can with the aim of both minimising disruption to the workplace and obviously preventing spread amongst work colleagues and then further afield into households and the wider community. If there are 2 or more cases in a workplace setting or in any setting within 14 days, then it's very likely that will be regarded as an outbreak, and an outbreak control team will be set up within Dudley Public Health, of which Environmental Health are part, and will be working with Public Health England to help the workplace manage that outbreak. And this will be in a really supportive way. So we'll be able to mobilise resources for testing of staff. We'll be able to assist the employer in getting anything that isn't quite right put right, and we'll be advising about how to manage staff who are cases and who are contacts. It isn't automatic that a workplace will have to close if there's an outbreak, or that all staff will have to go home. All colleagues of a positive case do have to isolate, close contacts have to isolate for 14 days. So obviously this can be highly inconvenient to both the employer and the employee. However, if the workplace complies with COVID secure standards, so the risk assessments have been done and the government guidance has been followed and the employer has put in all the recommended controls, then this is going to minimise the number of staff who are regarded as close contacts. So a close contact is a work colleague that you've worked within 2 metres of for more than 15 minutes. So it may be the case that no staff have to be excluded from work because they've been able to work 2 metres away from other colleagues. And this really should be a huge incentive to employers to put in place all the recommended measures to prevent that disruption should there be an outbreak. Next slide, please. So here's some further websites as to where to get further help and advice. The Dudley Safe and Sound website has advice on all sorts of issues, and the ones that might relate to the workplace can include modern slavery, safeguarding, and hate crime. The council's website has information on claiming benefits, and there's going to be some next presenters going to talk to you about the financial support. I mentioned earlier that you can call us in environmental health to report a health and safety concern. You can do that directly by phoning Dudley Council Plus. You can also go onto the council's website. The link is quite long, but the easiest way to do it is in the search at the top of the council website, type health and safety complaints, and it will take you directly to the form that you can fill in and alert us to an issue in the workplace. And then there's the Citizens Advice Service, of course, that are there to provide advice about many things. And that's the end of our presentation, and we're going to hand now to the next speaker.
Hi, good evening. My name's Sharon Tilt from Dudley Welfare Rights Service. I'll just say now, because I've had an absolute nightmare during some of the other presentations where I've lost my internet connection, so I'm just crossing everything that I'll get through this without losing any connection, and that you can all hear me okay. I've been asked to come along this evening just to give an overview of the welfare benefits system and how that might support people who were affected by COVID-19. Could I have the next slide, please? It's been long established that there's a link between health and financial well-being. But the COVID situation has had an impact on both factors for many people. Illness, a requirement to isolate or shield, or loss of work through downturn in business has obviously led to a loss in income. And for some people at the most extreme end, even a lack of basic requirements such as heat, food and shelter. And all of these things obviously can lead to increased stress, increased mental health, and cause deterioration in both physical and mental health. But it does seem, looking at the research and building on from what Dr. Lola was talking of earlier, that the effects are not being felt equally across the population. And there are many factors at play, but the research from Public Health England, understanding the impact on BAME communities, it was found that not only ill health, but also the economic impact of the COVID-19 shutdown had been felt differently across different ethnic groups in England. There are suggestions that for some groups, there are most likely to be men working in a shutdown sector, so restaurants, taxi driving, and where there may have been less demand, as well as having a partner who might not be economically active in the labour market. And obviously all those things are going to have an impact on finances. Next slide, please. Individuals from BAME groups are more likely to work in occupations with a higher risk of COVID exposure. So again, as Dr. Lola mentioned earlier, the health and social care workers and public transport, retail workers, cleaners, those jobs that are on the front line. And that's going to obviously lead to a higher increase in ill health. But as far as occupations and finances are concerned, people more likely to be self-employed, so restaurants, retail trade being affected by lockdown, people having less demand for services, and all of those aspects really, ill health, businesses being shut down, loss of trade, being on furlough, can lead to financial loss, and those things are then self-compounding. I would say that we don't know yet what the full economic effects are. Obviously at the moment there is support there from the government with the furlough scheme and the self-employed income support scheme. But as those things start to reduce and phase out later in the year, it may well be that there are more failing businesses, reduced turnover, more redundancies, or people being asked to work fewer hours. So my talk today really is aiming to equip people with knowledge of the welfare benefit system in order to support those who might experience financial loss or hardship, and hopefully then to protect well-being. Could I have the next slide, please? Okay, so the presentation is going to just include an overview of some of the welfare benefits available. There are lots of different benefits, so can't talk about all of them in such a small space of time. We're going to touch on some of the other help that might be on offer, but our focus really, as far as benefits are concerned, is going to be on people experiencing ill health, people losing income through self-employment and furlough, and people who might find themselves losing their job. Next slide, please. Okay, so we'll start by looking at people in employment who might be off work due to illness or experiencing symptoms or through self-isolation. And the first protocol for this really is going to be statutory sick pay. Now, this is only available to employees, so not for self-employed people. And you do have to be earning on average £120 a week in order to qualify. It's paid by an employer, usually paid on your normal payday. So if you get paid weekly, it would be paid weekly, if monthly, monthly. But it is paid for a limited time. It's 28 weeks entitlement. One of the changes that the government did bring in at the start of the lockdown and the measures that they've taken is to introduce that there were no longer any waiting days, because prior to that and for other illnesses there are waiting days. I think off the top of my head it's 3 days. So for people affected by COVID there's no waiting days, but you will require an isolation note. So that's like an equivalent really of a sick note, or a fit note as they're called now. I've put a link on the slide because you can obtain one through 111 NHS, but if you just Google isolation note, it will bring you the link and you can do it online. The rate of pay, it's quite low really. It's not going to replace most people's salary. It's £95.85 per week on the statutory scheme. Of course, it might well be that you're employed, your employer actually does pay contractual sick pay, and that can vary. There's no legal obligation to pay that. Some employers do pay full pay for a certain period of time, some half pay, some nothing at all. So obviously if you're in a situation where you're just going to get the basic £95.85 a week and you've got rent to pay, or you've got a partner to support, or children, that is not going to be sufficient and you might need to claim top-up benefits. And what I've done really is to sort of put the top-up benefits all at the end, so we'll come on to those later. Could I have the next slide please? For those people who might not qualify for statutory sick pay because they're earning under £120, or it might be you've already reached 28 weeks of sick pay from your employer, or you could be self-employed and not going to be qualifying for that at all. There is another benefit, and this is called New Style Employment Support Allowance, or commonly known as ESA. So it's a sickness-based benefit. You've got to be unable to work due to ill health in order to qualify. It isn't means tested. So you could have a partner who's working and it's not going to affect your entitlements. You could have a significant amount of capital in the bank and it won't affect your entitlements. Really, for this benefit, what they're going to be looking at is, have you got sufficient national insurance contributions? Now, they don't look across your whole working life. They are just looking across the last 2 or 3 years. If you're not sure, if you've had gaps in employment, you can go on to the government website and you can check your national insurance contribution record. But my advice to people, if they aren't sure, is to make the claim. Better to make the claim and have it refused because you haven't got enough contributions than not claim and find out that you've missed out somewhere later down the line. For as far as COVID is concerned, you can actually claim this benefit if a person or their child thinks that they might have the virus, or they're recovering from it, or they're self-isolating. There was an additional category for people who were shielding, but from today, government guidance has changed on that, so we don't think that will be available any longer. Could I have the next slide, please? Claims are made online, and again, I've put a link on there which will show you how to claim. Bit of a paltry £74.35 for people who are 25 or over, and if you're under 25 it's £58.90. So again, I come back to that situation where you might need the top-up benefits. It may well be that you haven't got enough contributions. You could have had a broken work history, or perhaps be in a 0-hour contract where your work fluctuates. And in those circumstances, it might well be that you'll qualify for universal credit, which I will talk about towards the end of the presentation. Could I have the next slide, please? So just briefly mention for people who are furloughed, what the scheme is there. Currently, the scheme was introduced in March, the Coronavirus Job Retention Scheme. And the aim of that really was the government trying to offer support to businesses to try to avoid high levels of redundancy because of the closure and downturn in business. So the assistance is given by Her Majesty's Revenue and Customs, and that's for employers. And it aims to support them to pay 80% of an employee's salary. There is a cap on that figure of £2,500, and the employer, if they want to, can pay the other 20% and top it up to 100%, but they don't have to, and that does obviously depend on individual employers. It may be available to some 0-hour contracts workers and agency workers, but it is usually where you've been doing regular work, either for what they call an umbrella organisation, so the staff agency is paying you and has paid you regularly, or it can be through somebody that you've worked for on a regular basis if you're an agency worker. The scheme was actually closed to new entrants from the 30th of June, so no new workers can be put on furlough by employers, but obviously if you're already on furlough, the scheme will still continue to support you for the foreseeable future. Next slide. Thank you. It is gradually being phased out, and there have been very minor changes that are taking place over the next few months. So from the 1st of July, they introduced a rule to say that workers on furlough could go back to work part-time if their employer wanted them to. Don't have to, but perhaps employer thinks, well, I haven't got enough work to take this person back full-time, but I could actually do with an extra pair of hands, so I'd like them to come in 2 days a week. In those circumstances, the employer would pay 100% of the pay for the hours worked, but the job retention scheme would support with the 80% for the other days. From the 1st of August, there is a requirement of employers to pay both the employer national insurance contributions and pension contributions, so just minor changes there. From September, the requirement will be introduced for the employer to pay 10% of the wages. So the employee will still get 80% all the way through this. It's just where the money comes from that will change. So the government will pay 70% and 10% will come from the employer. And then finally, from the 1st of October, there will be a requirement for employers to pay the national insurance, the pension, and 20% of the wages. As far as we know, at the end of October, the scheme will close, but obviously there's a lot of changes afoot and a lot of things could happen between now and then, and I know certainly there are people lobbying for it to be extended. Even if you are on furlough, that's still a loss in income if you're just getting the 80%. And if you only work limited hours, then it might be that you're not going to be able to manage on that money. And again, we can come back to our top-up benefits. Can I have the next slide, please? Sadly, with all the best will in the world, some people are going to find themselves out of work. If you've worked for the same employer for 2 years or more, then you should be entitled to a redundancy payment. And I've put a link on the slide for people who find themselves in that situation. It's a calculator, so you can find out what your rights are and what pay you might expect to receive. There might be, though, some businesses that will go under with all that support, and they might be insolvent and so not actually able to pay that redundancy pay. There is a link on that slide, but I've noticed it hasn't come through as a hyperlink, so we will try and get that sorted. But on the .gov site, There is an article which tells you your rights if your employer is insolvent, and you may well be able to get support through the government for that. So they may step in and then cover your redundancy pay at the statutory rate. Of course, your redundancy pay is going to largely be made up of pay in lieu of notice, some holiday pay, and then your a lump sum payment if you're lucky enough to have worked for your employer for 2 years or more, of course. But that will form part of your capital. So that means you can actually still access welfare benefits. And for those people who perhaps haven't worked for 2 years, then again, we're going to come on to welfare benefits that might support you through that situation. Can I have the next slide, please? Okay, so for people who find themselves out of work, who are fit and well and able to look for work, then the first benefit you're going to turn to is going to be new style job seekers allowance. It's a bit like the employment support allowance that I spoke of earlier, in that you do need to have sufficient national insurance contributions. So again, you can check your record. This is a benefit that's also claimed online, so it's a fairly straightforward process. I can see again the hyperlink hasn't come through, but if you just Google how to claim New Style Job Seekers Allowance, it will come up. It's fairly easy to find. For this benefit, the rates are the same as for ESA, so the £74.35 and £58.90 for those under 25. You have to be available for work and actively seeking work. So the job centre will support you with that, but obviously you also need to prove that you are taking those steps to try to get another job, which is going to be quite difficult, as we know, in the current climate. There is a limit on how long it's paid for. It's for 26 weeks. And like ESA, it isn't means tested. So if you've got a partner that's working, it's not going to impact on your ability to be able to claim this benefit. If you've got insufficient contributions, it's universal credit. And again, top-up benefits might be required if you've got rent to pay and you've got children or partners. Can we move on, please, to the next slide? Okay, so just a brief mention of the self-employed income support scheme. I hope that most people, if they are self-employed, do know about this scheme and have accessed the first round of funding. But if you haven't, if you have missed out for whatever reason, there is another round coming up shortly. So I'll just run through what the basic criteria is for qualification. You have to have submitted a tax return for the tax years 18-19, and the deadline for that was the 23rd of April. So if you didn't do it, if you missed it, there is no way back from that. You have to have a trading profit of less than 50,000 for the tax year 18-19, or if you did have a profit of more than that, they will look at the averages for 16-17 and 17-18, because it might be that in 16-17 you were a new business and you actually made a loss. In 17-18 you might have increased, and in 18-19 you might have got more. So they will average that out. You need to have traded in tax year 19-20 and have an intention to carry on trading in 2021. So even if you're not back at work now, that you do intend to go back before the end of the tax year. And what they paid in the first phase was 80% of monthly profits, averaged over a 3-month period, with a maximum of 2,500 per month, so a total of 7,500. That's now been closed, and most people who, if they did apply, should have had their money. I will flag out that if you're using the online calculator and it's telling you that you don't qualify and you think you meet those rules, please call HMRC, because I'm aware of a number of people who were told that they didn't qualify and they did, and when they challenged it, they did actually get their payment. So, you know, look at the rules and just double check. The second phase of applications is opening from the 17th of August. So it will be on the Revenue and Customs website, and it will be open for applications from that day. The rules to qualify are almost identical. The one thing that has been introduced is that you have to certify that your business has been adversely affected by coronavirus on or after the 14th of July. And that rule is there because it might be that in the early stages, some businesses have carried on being able to trade, and then after the 14th of July, they've seen a downturn in business, or conversely, they've gone back to work, but then realised, well, actually, I'm not going to be able to get the same level of income as I did before. And an example of that might be hairdressers, because usually, ladies in particular, you'll know if you go to get your hair done, sit you in the chair, there's other people waiting to be seen at the same time, and they tend to juggle everybody. But because of the social distancing rules, they can't do that any longer, so they might be seeing half as many clients. So adversely affected after the 14th of July can still be trading though, and this time round it will be 70% of average monthly trading profits. Again, over 3 months, so the cap is 6,570. You can get the second grant even if you didn't claim the first, or you can get both, and obviously that will depend on your situation with your business. Could I have the next slide, please? If you're currently in receipt of housing benefit and council tax reduction and you have a fall in income, then we would ask you to report your changes to benefit services. That's Dudley Council. And I've put a telephone number on the slide, and what they will do is actually recalculate your benefit to see if you might qualify for a little bit more help. If you're not currently getting help with your council tax, you can phone the same number, and they will help you fill the form in if you're going to struggle to do that, or there's a link to an online claim which you can actually do and submit online. If you need help with your rent and you're not currently getting housing benefit, then for most people the benefit that you're going to need to claim is universal credit. And if you're getting benefits or not, and you're struggling to pay your council tax, then you can call the number there, which is the council tax team, and they will help you to reschedule or defer your payments. The worst thing you can do is to just ignore it and bury your head in the sand, but they are very helpful and very accommodating, so please pick the phone up if you need that extra support. Could I get the next slide, please? For people that might have a mortgage, means tested benefits such as universal credit, income support for those who get it, and other benefits can offer help with mortgage interest. But an important change that occurred a couple of years ago is that it's no longer just given as a benefit, it is a loan. It isn't interest free, and the DWP will put a charge on the property so that if at some time in the future you move or sell your home, they will recover the loan from the equity. For that reason, we always recommend that people get independent legal and financial advice before they take out the loan. You might want to check to see if you've got a mortgage protection policy. Some people could have had their mortgage for many years and be paying a policy that they've forgotten about, or it could be tagged on to something, some other payment that they're making to their lender. So check for that. Or you may well be eligible for a mortgage holiday, and this is where the mortgage repayment might be deferred. Interest will though still accrue. And not everybody is eligible. So if you're struggling, please talk to your lender and find out what support is available for you. Okay, so the next slide, please. Okay, so if you've already got children and you're getting tax credits and housing benefit, the most important thing I can say is please get a benefit check before taking any decisions on whether to jump to universal credit. Universal credit will end any legacy benefits. Those are tax credits, housing benefits, income support. Some people will be better off, some people will find no difference, but undoubtedly there are people that are worse off. So please seek advice before making that jump. If you're not already getting any benefits, then most people will not be able to claim benefits like housing benefit and tax credits, so it will be universal credit instead. And I'm just going to finish off my talk by very quickly talking through how that works. So if I could have the next slide, please. Okay, so it's been around for a number of years now. It's replaced all of the means tested benefits, so tax credits, job seekers allowance, income support, housing benefits. It's paid monthly in arrears, and there is a 5-week wait for the first payment. And the reason for that is that they have to assess your circumstances within the first month. Lots of things might happen. You might be working and lose your job, you might have a baby, and so they will look at the end of the first month and see what's happened, what are your circumstances now, and then they have a week then to issue your first payment. It is quite a long wait, so you can have an advance of benefit, which is a loan, and the repayments will be taken directly from universal credit, spread over 12 months currently, though that will change to 18 months later in the year. We talked about the statutory sick pay and the new style ESA and JSA, and universal credit is the top-up benefit for those people who might have partners and children, because obviously you will still need extra support, and for those who need help with rent where they're not currently getting housing benefit. It is a means tested benefit, so they will be looking at whatever income you've got coming into the household, and there are capital rules. For more information, you can access the .gov site. The applications are made online, and I've put a link on there. If you do need help to claim and you can't do it yourself, the Citizens Advice Bureau do have a help to claim service, which is specifically for universal credit. Next slide, please. If you do need any further help, there is an online checker available on the .gov site, so you can put in your circumstances and hopefully it will accurately tell you what you're entitled to. Our Welfare Rights Service at Dudley Council have a new helpline, unfortunately only 2 days a week because there are only 3 of us, but available Tuesdays and Thursdays, 9:30 till 1, 2 till 4:30, and it is specifically for people affected by coronavirus to get benefits advice. So please call us if you need help. The DWP currently are having limited face-to-face contact with people, mainly it's with the people who are the most vulnerable and can't self-support. The DWP, if there is anybody struggling with English as their first language, they use a translation service, or should do, called The Big Word. And at Dudley Council, if there's no one to help, you know, family member, then we can use L2L. And I do believe that that is the end of my presentation. So I will hand over to the next speaker, and thank you for listening.
Hi everybody. Our next speaker was due to be my colleague Cassius Francis, who works for the Just Finance Black Country stream of our work. Sadly, he can't be with us tonight in person, but he's recorded you this video, and then I'll be available at the end to ask any questions. So by the wonders of technology, Cassius will appear remotely.
Good evening. My name's Cassius Francis. I'm the Just Finance development worker for the Black Country, and I've just got a few minutes to share some key things with you in thinking about money over these forthcoming months. Firstly, just to provide some context, the Step Change Debt Charity have said that we estimate 28% of adults, 14 million people, have experienced a negative direct effect on their income as a result of coronavirus. So we know that there will be a lot of people out there who will be struggling. It goes on to say a broad swathe of the population has been affected, but those who are younger, female, and are responsible for children or in insecure work are most likely to experience or have experienced a negative impact. In addition, we know that Black, Asian, minority ethnic communities are overrepresented when we talk about poverty, and there are plenty of reports and information available that we can find to back that up with data. In relation to Dudley specifically, there are around 11.5% of the population made up from ethnic minority groups. In May 2020, the Job Seekers Allowance data shows that Black and Chinese and other ethnic communities are currently above comparative average numbers for those in England, Wales, and the West Midlands region. So that's representative of those who are going to be out of work claiming benefits. And I'm thankful to Greg Barbosa from the council for the time that he spent pulling a number of figures and data together. The Money and Pension Service says that we know that there are a number of people who are going to need to be accessing debt advice. And just to encourage you that if that is you this evening, free help is available. Two great sources of information that I can recommend. Firstly, the Money Advice Service, .org.uk is a great website and with lots of information straightforward to access. And our friend Martin Lewis at moneysavingexpert.com has a great website as well, very informative and very up to date. If you're wanting to access help through a small grant, perhaps around £100, again, two websites that we can recommend, acts435.org.uk, where organisations can register and they can help individuals who might want to access a grant. That's a Christian grant funding website and is one that is highly recommended. There's also the National Zakat Foundation, which is a Muslim charity that operates along similar lines, allowing people to access money for basic costs. There are also some great budgeting tools available, and if you haven't looked at these before, I'd really recommend that it's a good time to start looking and thinking about budgeting. And I would suggest three scenarios. You might have done your normal budget, which is pre-coronavirus, pre-lockdown. But I would also suggest doing one for the best case scenario, one that's coronavirus affected, and also one that's the worst case scenario, to give you a picture of actually how will we be able to cope if there are things that come unexpectedly, if there's a loss of job, a bereavement in the family. How will we cope financially? What kind of things can we do to be preparing for those circumstances? There are great online budgeting tools. Again, Money Advice Service have a great one. Step Change have one that's downloadable and printable. And there's also an Excel spreadsheet that you can download from Money Saving Expert. And just one line from Step Change to read. If a family has £1,000 in accessible savings, it reduces their chances of being in debt by 44%. That's again pre-COVID, but just gives you an indication that if you are able to save a little bit on a regular basis, it puts you in a good position to avoid some of those financial shocks. Again, free debt advice is available through Payplan, through Citizens Advice, also through tully.co.uk. And there are also helplines, the National Debt Line and Step Change that you can access. It's also really important for us to raise awareness at this time around illegal moneylenders. We know, unfortunately, that there will be people who will seek to really prey on the vulnerable during these difficult times. So we do raise awareness around loan sharks as well. There's a free phone number. There's also a website that people can access. And in terms of what we're doing with Transforming Communities Together, I'm personally delivering a course called the COVID Cash Course that enables people to have access to the information that is updated and ready to support people in really practical ways. We're running that as a Training the Trainers course. So if you are a leader in your community or your church or faith group, please do get in touch. We'd love for you to be able to come on that course with us. And we're also running virtual coffee mornings every Thursday for anyone who is supporting people with money worries or debt. I just wanted to finish by just sharing a short video, 2 minutes long, from your local credit union, Castle and Crystal, based in Dudley. If you haven't heard of credit unions, they are non-profit organisations who run for the benefit of their members. Often they will offer loans at lower rates than other high street providers. And so I just wanted to share this short video with you and really hope that we'll be able to meet with you soon.
I was attacked by the stroke, see, and my whole world changed. Previously been diagnosed with the terminal stages of bronchitis. Just before it becomes pneumonia, my GP told me. I was in a dilemma because there was no double glazing on my windows. There was no cavity wall insulation, loft insulation, nothing. All I had was the central heating and the fire in the living room, and the cold wind whistling through the house. I had to keep the fire on all the time. My energy bill shot through the roof, and so I needed to get the windows and the walls done immediately. When I went to the banks that I've been banking with for over 20 years, people who know me, no help, just rejected because everything by then was computerized. And they could do nothing to help me because if the computer said no, it was no. So I went knocking on another bank and another, then went to the building society, everything no. So despair and hopelessness set in, and I was becoming afraid because I was locked up in the house, cold wind coming through, can't afford to turn the heating off. When I remembered Dudley, Castle and Crystal Credit Union, that they were my last hope before the loan sharks. So when in 48 hours, they told me the loan was approved, I had to pinch myself. I was filled with delight overnight. If you live in or work in Dudley, just knock on their door and there's a big help sign. It's invisible, I'm telling you about it. And they, I know, will be willing to help you. My health has been fully restored thanks to the caring, helping, ethical lending of Dudley, Castle and Crystal, who literally saved my life.
Thank you. Such a moving video. We're going to go straight to Anne Horder now with questions. Thank you. And James, thank you very much.
Thank you, Jackie, and thank you to all our speakers for a most excellent set of presentations. It's been an amazing journey over the 5 weeks with excellent speakers on each of the 5 sessions, and each week I'm amazed at the new things that we're all learning. I gather that Lola, our main speaker from tonight, has to leave at 8:30. So I wonder whether we could just give you a cheeky question, Lola, before you do head off, to ask you, where would you start with some of the things that you were talking about tonight? I'm thinking of your blue grid. And where would you begin? You mentioned about the Embrace report. If you can be getting ready to unmute, Lola, that would be great. You mentioned the Embrace report with the devastating figures of 5 times the increase of women dying in pregnancy when they were from the BAME background, and the need for sensitive, accessible services. But that's one particular service issue. But where would you start more generally? Thank you.
As I sort of intimated in my talk, there's a whole host of actions that we need to be taking at many different levels. I think I'd probably start with, as you know, we are still having outbreaks of COVID-19 affecting our local communities. We do know that some of the rates are increasing around particularly the Black Country, Birmingham, places like Sandwell has come up in terms of what we've heard on the news. And I think it's something about getting our communities ready. And we know the long-term conditions, diabetes, hypertension, overweight, are things that are making our communities much more vulnerable. And so I would be saying, let's start by addressing some of these long-term conditions, getting those long-term conditions under control. People are under a lot of pressure, and I think one of the previous speakers talked very eloquently about the impact on mental health, particularly about the financial pressures in relation to COVID. Yes, there's a lot of help that people can access, and I hope that they will do that. But the things that we can do for ourselves are about getting out there with physical activity, sharing our cares and concerns with other people within our community. That listening area problem shared is a problem halved. So those are the practical things that we can do to support each other to get through some of the some of the immediate challenges. Those of us working, the risk assessment at work, making sure that we can stay safe. I think starting with those things are the things that I'd probably focus on now, because we still have a long way to go through COVID, and we do need to be prepared. But as I said in my talk, physical activity is a great medicine. I smile while I'm saying this because it's really made a difference for me, and getting out there, having a walk, makes you feel better in yourself. It's helpful if you've got blood pressure, and if you've got diabetes, and it improves your diabetes control. But it's a great family thing, with those in your household, who are able to go out with you. So, and it will help to keep your spirits up together.
Thank you. I think, Lola, you even referred to activity as a magic medicine. So if it gives people fun as well, that's an extra benefit, isn't it? Thank you so much for your time and for your advice there on starting with what we can do with our health, thinking back to the diabetes talk, getting our diabetes under control, thinking about making sure if we have asthma that we're using the right inhalers, and if we've not had a checkup recently, phoning our local surgeries to ask, can we have a health review? Those are all good things that we can do, and then being active. Lola, we wish you well in your ongoing work, and thank you very much. If I can just go to one of our other speakers now. We had a question here for in the chat that says the media seems to be blaming teenagers and young adults as the spreaders. Is this evidence-based? That's the first part. And then how can we target messages better to this age group? And I think we could extend that question further, actually, because I think one of the problems that has been identified is that a lot of the health messages haven't been terribly well tailored to any of our BAME populations. And that's something that we need to learn to do better. Julie, would you have a view on that?
Okay, I haven't seen evidence that teenagers are necessarily spreading that, but I think that's still probably Dr. Lola would have been in a better position to respond to that. I don't deal with young people that much because I'm workplace focused, so I can't really say much more than I haven't seen lots of evidence on that basis. But in terms of media's representation, it's not always accurate, and as I say, there's often fake news and spin, isn't there? So don't always believe what you read would be my advice.
Thank you. I've got a question for Dolores. Have employers in Dudley been good at following the COVID secure advice on the whole?
I would say yes. Most employers want to do the right thing. They don't want there to be litigation and issues with making their staff and customers ill. So yes, they have. That said, we have throughout this pandemic period dealt with complaints from either employees or members of the public. For example, I was doing a press inquiry the other day, and I was asked how many pubs we had complaints about social distancing, and we've had 16 in the borough, but we've got something like 300 pubs, and when the complaints were looked at, all the pubs had risk assessments, but they probably just weren't maybe managing it the whole time during a busy evening. So in the vast majority of employers are doing the right thing. They're needing help and support, which we're giving them, but we do rely to a large extent on staff and customers to tell us what's happening when we can't be there. So yes, I would say that businesses largely do their best to comply.
Thanks, Dolores. And a question for Sharon. What's the difference between new style JSA and universal credit?
Sorry for the delay. Can you hear me and see me? Yeah.
We can. Thanks.
Yeah, new style ESA and JSA, they are what we call contribution-based benefits. So you can only get them if you've got sufficient national insurance contributions. And the other main difference is that they are paid for the claimant only. So if I'm married and my husband is working full-time and I lose my job, I can still get that benefit. Universal credit is means tested. So you don't have to have any national insurance contributions, but they are going to be looking at, in that same scenario, the income of my partner who's working. So that's really the main difference. One is means tested and one is not. Universal credit also covers money for a couple, so it's assessed jointly, money for children, money for housing costs, money to cover illnesses or disabilities as well, extra premiums, as well as childcare. So it's sort of taken many benefits and rolled them all into one. So tax credits, for example, where you would claim for help if you were working and on a low income, and child tax credit if you've got children, has all been replaced by universal credit. Whereas the new style benefits, they are just one person situation. Does that help?
That's really helpful, Sharon. Thank you.
Thank
Got
you.
just one more opportunity really for Sandra Vaughan, if she'd like to be unmuted, please. She's put in the chat that we can see on the social media video that shows how Dudley Mind have adapted their hub on Bushy Fields for COVID to protect the staff and anyone coming in for appointments. And I just wonder, Sandra, if you'd just like to have a minute to just tell us a little bit about the steps that have been taken and how confident people can be if they actually go and visit Dudley Mind there. Thanks.
Yep. Yeah, because we've been back in the building for a few weeks now. So we've made sure that obviously we've stripped it out so that there's only what's absolutely necessary in there. The office space, we've got screens on desks, only 2 people into the office at one time. The other 2 offices, we can self-distance quite easily. The main room, we've actually got screens on the tables there. We only have 2 tables there. We can actually seat, I think, 4 people without them being at risk. We've got all the hand sanitizer, PPE at the door. We're offering for people to come and use the computer there if they don't have access to the internet. And we're helping them with that. That's sanitized after everybody's used it. We've got absolutely loads of sanitizing equipment, and everything is sanitized after use. We've got our groups back and running now, 2 face-to-face groups on anxiety and depression. We've got one on Zoom, which we've had for a couple of months now. We're just looking at launching the bipolar disorder group back on Zoom as well. So we're really trying to move forward because people need that face-to-face. They're feeling really isolated. But anybody's welcome to come and visit us. Just give us a ring first because we will only allow so many people in at a time. But we're looking now to open up on a Sunday as a drop-in, but with a restricted number of people.
Thank you ever so much, Sandra. That's really interesting. I'm so thrilled that you've got so much sanitizer and the efforts that you are taking to keep that place as safe as it possibly can be. Our time for questions is actually up now. So what I will say, we'll do the same as last week. If there are any questions that are unanswered, we'll put them in a PDF underneath the online YouTube video that will be on Cornerstone's website, hopefully by the end of next week. And if I can hand over back to Jackie again. Thank you now.
Thank you, Anne. And thank you, everyone. I think if we can stop the recording there, that would be great. Thank you.